Look, if you or a loved one are gearing up for knee replacement surgery, you already know it's a monumental decision. So today, we're jumping right in to demystify the grueling but absolutely rewarding 90-day journey of knee replacement recovery. Think of this as your comprehensive roadmap, taking you from the operating room all the way back to the active life you love.
Here's our roadmap for the journey ahead. First, the crucial 90-day window. Then, preparing your recovery base camp, followed by a look inside your healing knee, navigating that first month, and finally, managing pain and emotions. Let's get to it.
Section 1. The crucial 90-day window. This first phase, it's undeniably the most critical window of your entire recovery. I mean, what you do here literally sets the foundation for your next decade of mobility. To understand why, just think about the femur, tibia, and patella. Your surgeon meticulously removed the damaged cartilage and capped those exact spots with metal and plastic. When you really wrap your head around that physical alteration, well, it makes it a whole lot easier to understand why your knee feels so incredibly strange right now.
You've really got to manage your expectations early on. This is a marathon, not a sprint, guys. The soft tissues around your brand new implant respond dramatically to movement and load during these specific weeks. It's an intense period of physical adaptation, and you're going to need a ton of patience to see it through to the finish line.
Section 2. Preparing your recovery base camp. Now, before you even step foot in the hospital, you absolutely have to prep your physical environment at home. Setting up tools like a front-wheeled walker, a raised toilet seat, a shower chair, and grab bars, doing all of this gives you immediate agency. You're basically building a safe, highly functional terrain in your own house. And honestly, this setup is your absolute best defense against that temporary loss of independence. Oh, and definitely don't forget that long-handled reacher so you don't have to bend down, and stock up on plenty of ice packs.
Because here's the thing. You aren't just passively sent home from the hospital. You actually have to earn your discharge back to that base camp you just built. You'll need to prove you can get in and out of bed on your own, walk 50 to 100 feet, safely tackle stairs if your house requires it, keep your pain in check with oral meds, and show you fully understand your PT exercises.
Which brings us to Section 3, Inside Your Healing Knee.
To logically make sense of every single ache and pain you'll feel over the coming weeks, you have to understand the invisible work your body is doing. Days 1 through 10, that's your acute inflammatory phase, where swelling and pain are definitely at their peak. Then, up to week 6, you enter the proliferation phase, where new tissue is actively forming. Weeks 6 to 12 are all about remodeling and rebuilding muscle strength. But get this, it might actually surprise you to know that bone integration continues for up to 18 months. That profound biological reality just proves exactly why you cannot rush this journey. When we translate those unseen biological phases into an actual experiential roadmap, it gives you some really clear, achievable milestones. You can literally trace your path. You go from the walker phase in weeks 1 and 2 to transitioning to a cane, right up to hitting 90 degrees of range of motion. And by month 3, you're targeting 115 degrees of flexion and getting right back to your normal life. It gives you incredibly concrete targets to aim for.
Next up, Section 4, Navigating the First Month.
Look, your main goal in those first, let's be honest, grueling 30 days is simply to protect your new knee and avoid any major setbacks. There is zero room for ambiguity here. You've got to internalize the difference between what's normal and what's not, distinguishing between standard post-op symptoms like warmth around the incision, some clicking sensations, or swelling that gets a bit worse by evening, and a critical warning sign like sudden calf pain. That could literally be life-saving. If you hit a fever over 101 degrees, experience shortness of breath, or get sudden, severe pain that your meds just aren't touching, you need to contact your surgeon immediately.
Finally, Section 5, Managing Pain and Emotions.
To really succeed, we have to tackle the physical pain head-on. This demands a super methodical daily routine for managing that persistent swelling, which is absolutely crucial for pain control. The toolkit here is all about consistency. Number 1, elevate your leg above heart level. 2, apply ice for 15 to 20 minutes at a time. And 3, wear those notoriously stubborn compression stockings. Sticking to these steps effectively knocks down inflammation, and maybe more importantly, it gives you back a strong sense of control over your day.
But that brings us to the second dragon we have to slay, the psychological toll. I want to pause for a second because this concept is vital. So many patients are completely blindsided when they realize the 3rd or 4th day after surgery is often the absolute hardest emotionally. The anesthesia's totally out of your system, your sleep is probably a mess, and the immense amount of work ahead suddenly becomes very, very real. Listen, feeling frustrated, sad, or overwhelmed during this window is perfectly normal. Just acknowledging that fact is the very first step to managing it.
Following some basic strategies ensures you're actively fighting off the mental fatigue that almost always shadows physical recovery. Set just one small daily goal. Keep a simple progress journal. And seriously, avoid comparing your progress to anyone else's. Every single body heals on its own unique timeline. Celebrate the little wins, like that first walk outside. And please, accept help graciously. Recovery is definitely not the time to try and prove you're totally independent.
I'm going to leave you with a final provocative thought to spark your motivation as you gear up to tackle physical therapy and reclaim your active life. Your first 90 days dictate the entire quality of your future mobility. You have the roadmap, you know the milestones, you understand the biology. So, how will you take your first step today? Thanks so much for joining me for this explainer, and best of luck on your road to recovery.